So my name is Mike, and I teach human anatomy and physiology in 3 nursing colleges. So a man that is not able to impregnate his wife is either infertile or impotent. So the thing is, both words are normally used interchangeably, and some persons don't even talk about impotent. They just attribute everything to infertility. So in this video, I'm going to give you a clear distinction between infertility and impotence, and I'm going to make this video to be very short. So let's start with the definition of the terms. Infertility, according to WHO, is the inability of a man, remember I'm talking about male infertility, is the inability of a man to impregnate his wife after 12 months of regular and unprotected sexual intercourse. So the definition did not say after 12 months of marriage. It says after 12 months of regular and unprotected sexual intercourse. Now, because it is possible for 2 persons to be married and not having sex, for whatever reason. It is also possible for 2 persons to be married and not having regular sex. So regular sex is sex that occurs at least 2 to 3 times in a week. It is also possible for 2 persons to be married and having sex with condoms and other contraceptives, that is protected sex. So for you to conclude that a man is infertile, there are 3 things you have to check. First of all, you have to make sure that the man is having sex. You have to make sure the sex is regular and it is unprotected. He's not using any condom or other contraceptives to prevent pregnancy. And you also have to make sure the wife is not also taking contraceptives to prevent pregnancy. So these are the 3 things that need to be met for you to conclude that a man is infertile. So a man that is infertile is having sex, but he cannot impregnate his wife. Despite having sex several times a day or several times a week, he cannot impregnate the wife, despite the number of sex rounds he has. So that's what infertility is. So now, how is this infertility different from impotence? So a man that is impotent cannot have sex. He cannot have sex. He cannot have penile sex. He might be able to have other forms of sex with the wife, but he cannot have penile sex. So impotence is the inability of a man to achieve and maintain proper erection for a considerable period of time after several attempts. So in very simple terms, the penis of a man that is impotent cannot rise even in the presence of his wife. Even if the penis rises, it will be for a very short while, for a few seconds. Before penetration, it will come back to its flaccid state. So despite the stimulation, despite the thought, despite everything, the penis of the man that is impotent cannot rise. So impotent is commonly known as erectile dysfunction. So, but I need to state here that once in a while, a man can experience failed erection, maybe due to stress or not just being in the mood for sex. So, impotence is not when you experience it the first time or second time or 5 times or 10 times. Impotence is when it happens several times continuously. In fact, it is stated that impotence is when it happens continuously for 6 months. So that's when it becomes impotent. So for 6 months, you've been struggling to have sex, but you're not achieving erection. So that's when it becomes impotence. So with this definition, you can see that infertility is different from impotence. A man that is infertile is having sex with the wife, but he cannot impregnate the wife. And I'll talk about that later shortly. Though I don't want to make this video very long. While a man that is impotent cannot even have sex, he cannot have penile sex with the wife, and that's why the wife is not getting pregnant. So this is the first difference between infertility and impotence. Then another difference between infertility and impotence is that infertility occurs in both men and women. So we have male infertility and we have female infertility. So male infertility is the inability of a man to impregnate his wife, while female infertility is the inability of the woman to conceive. But impotence occurs only in men. So infertility occurs in both men and women, while impotence occurs only in men. So briefly, let me just state the causes of both infertility and impotence. So the causes of infertility are different from the causes of impotence. So let's start with the causes of infertility. Now, infertility is generally caused by issues with sperm cells, problems with sperm cells. Is that the man is not producing enough sperm cells or is not producing quality sperm cells? So there are several causes of infertility, and I'm not going to exhaust them in this video. I'm just going to list like 4 of them. So the first cause of infertility is inability of the man to produce sufficient sperm cells, popularly known as low sperm count. According to WHO, low sperm count is when a man has less than 15 million sperm cells per milliliter of semen. So you see that whitish fluid that comes out from your urethra when you get to orgasm, when you ejaculate. That substance is called semen. It contains sperm cells and some other fluid. Now, in that semen is about 5 milliliter. So in just 1 milliliter, you are expected to have at least 15 million sperm cells. There are men that have 100 million, 200 million, several of them. So you are meant to have at least 15 million sperm cells. So according to WHO, if you have less than 15 million sperm cells in 1 milliliter of that fluid that comes out from your urethra, of that semen, you have low sperm count. So it's not as if a man with low sperm count will not be able to fertilize his wife. It's just that the chances become low when you have low sperm count. So that's one of the causes of infertility in men, low sperm count. Then the second cause of infertility in men is inability to produce viable or quality sperm cells. A normal sperm cell is meant to have about 3 parts. It's meant to have one head, a neck, also known as midpiece, and a tail, also known as flagellum. So then within the head, you have all the organelles, you have all the things that are found in the cell. And you have the mitochondrion that gives energy to the sperm cells. Then you have the nucleus that contains DNA and the rest of it. Then the tail, the flagellum, is actually what the sperm cell uses to swim, to move towards its target site. Now, if you produce sperm cells without this basic shape, there's no how those sperm cells will be able to fertilize the egg. So there are some men that produce sperm cells with 2 heads. Yes. There are some men that produce sperm cells with 2 tails. There are some men that produce sperm cells with tails that are too short. There are some men that produce sperm cells without DNA in the head. So there is no how these sperm cells, no matter the number, will be able to fertilize the egg. So this is one of the causes of infertility in men. Then another cause of infertility in men is genital tract blockage. Now, the sperm cells are produced in the testes, and the testes are located in the scrotum. So from the testes, the sperm cells move to the epididymis. From the epididymis, they move to the vas deferens. From the vas deferens, they move to the ejaculatory duct. From the ejaculatory duct, they move to the urethra. Then from the urethra, they move to the vagina, which is meant to be the target site. Now, if there is blockage in any of this pathway, there is no how the sperm cell will be able to get to that destination. In fact, there are some men that experiences what is called retrograde ejaculation, where the sperm cells uses another pathway. They don't get to the urethra. Especially that most commonly is when the sperm cells goes to the bladder. So when you get to orgasm, you ejaculate, but the sperm cells do not come out. They go into the bladder instead, where urine is stored. So there's no how this man is going to be able to impregnate the wife, because the sperm cells, he cannot deposit sperm cells into the vagina. In fact, sometimes the sperm cells might just come out a little. In fact, that's one of the causes of low sperm count, retrograde ejaculation, because most of the sperm cells are going to a wrong destination. So that's one of the causes of infertility in men. I've listed like 3. So I've listed low sperm count. I've talked about having non-viable sperm cells that are not of good quality. Then I've also talked about genital tract blockage. Now, another cause of infertility in men is a disease condition known as cryptorchidism, undescended testes. So like I said, the testes are found in the scrotum, and the scrotum is outside the body. There's a reason why. The sperm cells are meant to produce, they are being produced on a temperature that is lower than body temperature. So sperm production cannot take place on body temperature. So they need to, production takes place on a temperature that is 2 to 3 times less than body temperature. So the testes were actually produced or formed in the abdomen, the abdominal cavity, in your belly. That's where the testes were formed. Those testes that are found in your scrotum, they were actually formed in the abdomen. But because the body is too hot for them to produce sperm cells, they had to move down to the scrotum. But I can tell you that there are some men that have undescended testes. Their testes is still in their abdomen or maybe somewhere close to where it's supposed to be. So there's no how these men can produce viable sperm cells. So the temperature there is too hot. So there's no how they can produce viable sperm cells. So such men will normally experience infertility because their testes is still in their abdomen and it cannot produce sperm cells in that location. So these are some of the causes of infertility in men. So infertility is generally linked to problems with sperm cells. So the man is having sex, but he cannot impregnate his wife because he does not have good sperm cells or good number of sperm cells. So that's why a man with infertility cannot impregnate his wife. So now let's look at impotence. So if I learned something from this video, at least give me a thumbs up now, like appreciate me now. Just click on the like icon on your screen. It won't take anything from you. So please, just click on the like icon on your screen. It's not going to take anything from you, but it means a lot to me. Just click on the like icon on your screen. And then if you've not subscribed to this channel, you're going to miss a lot. So don't say I didn't tell you. Just subscribe to this channel. It is also free. It doesn't cost anything, but it means a lot to me. Thank you so much as you do that. All right, so let's look at impotence. So a man that is impotent cannot impregnate his wife because he cannot have sex with the wife. And he cannot have sex with the wife because of poor erection. So he might be having other forms of sex, oral sex, any kind of other forms of sex, but he cannot have penile sex. And it is penile sex that leads to pregnancy. So because of poor erection. So there are several things that leads to poor erection. Sometimes it might just be performance anxiety, thinking so much about sex, having fear for sex itself, having negative beliefs about sex. So all these things can actually impact on your feelings. So one of the greatest causes of impotence in men is not even a disease, it's not disease conditions, it's psychological. So that's one of the greatest causes of infertility in men. So performance anxiety, fear of sex, it can even be religious beliefs, like what to think about sex, maybe the kind of whom you come from, the kind of things we've talked about, the kind of information they've given you about sex. Apart from psychological causes, a medical cause of impotence in men is blood flow, problems with the cardiovascular system. So for you to achieve that erection, there needs to be blood flow to the penis. So what makes that penis to be long, large, and rigid is because of blood flow, blood that has filled, the penis has spaces known as sinuses that blood runs into. So blood will have to fill, once you get aroused, blood will flow to your penis and fill those spaces, and that's what makes it to be large. So if there is blockage, and it is arteries that takes this blood to that destination. So if the arteries are blocked, there is no how blood will be able to flow to that area. If maybe cholesterol or anything has blocked those arteries, so there's no how blood will be able to flow to that area, and that will lead to erectile dysfunction. So that's like a medical cause of impotence. So there are several other causes of impotence, but I don't want to make this video to be too long. So finally, if you watch this video and you feel you have any of these issues, if you feel you're having any of this problem, these things can actually be solved. So you can visit the nearest hospital and speak with a urologist. So a urologist is a physician, a medical doctor that specializes on issues with the male reproductive system. So you can actually visit the nearest hospital and ask for their clinic days and talk to a urologist about this. Sometimes it is just advice you need, like in the case of impotence. Yeah, sometimes it might just be psychological. They cannot believe you have about sex. And all you just need is counseling and you'll be over it. So don't keep this to yourself. One thing with men is that they keep things to themselves. So don't keep things to yourself. Make sure you take care of your reproductive health. If you feel you've experienced any of these things, or if you have fear of any of these things, make sure you visit the hospital to speak with a urologist. Thank you so much for watching this video to the end. If you've learned anything, please, like I said, give me a thumbs up by clicking on the like icon on your screen. And please, I'm going to be dropping more of this kind of videos. So if you want this kind of videos, make sure you subscribe to this channel. Thank you so much and see you in my next video.